Good morning, everyone. It's a call and response kind of thing. Good morning, everybody. I'm so happy to have you all here with us this morning. My name is Notisha Massaquoi. I'm the Executive Director of Women's Health and Women's Hands Community Health Centre. We are one of Ontario's community health centres, but we're the only one that specializes in interprofessional care for women, prioritizing Black and racialized women in particular. We're very pleased to host this announcement this morning as one of Ontario's community health centres. We are celebrating our 25th anniversary this year, and we understand that while women are experts in their lives, it is the role of our interprofessional healthcare team to work with our clients to achieve their maximum potential by improving their health outcomes. In fact, 25 years ago, when women's health was established, we understood that a model that leveraged the power of interprofessional healthcare teams would be the only way to address the barriers to accessing primary healthcare, particularly for racialized women and other marginalized communities who are also dealing with systemic discrimination, the impact of social determinants of health, and as a result, numerous health disparities. I've had the pleasure of working at Women's Health and Women's Hands for the past 20 years, and I've seen the impact that interprofessional teams have brought to our clients through the work of the incredible staff of Women's Health and Women's Hands, some of which you see here supporting us today. Just to give you an idea of some of the incredible outcomes that our center has benefited from the work of interprofessional teams, 745 clients accessed our mental health services this year, and only 7 reported emergency department crisis visits. 90% of all HIV-positive babies were born to African and Caribbean women, but at Women's Health and Women's Hands, through the amazing partnership with the P3 program at St. Mike's, we have held steady. Despite having 400 positive clients, our mother-to-child HIV transmission has held steady over the last 5 years at 0. And we serve the populations with the highest prevalence rates of diabetes, but 90% of all of our diagnosed clients have received interprofessional diabetes care, which we know is the best indicator for successful disease management. The work of our interprofessional team extends beyond the borders of Women's Health and Women's Hands, and we can't do this work and accomplish such amazing outcomes without the support of numerous partners, some of which are in the room today, and I'd like to acknowledge the executive directors from Africans in Partnership Against AIDS, the Alliance for South Asian AIDS Prevention, Community for Accessible AIDS Treatment, the Provincial Y Program. We have Jay McGilvery, a midwife specialist with the Positive Pregnancy Program at St. Mike's Hospital, Hazel Palmer, the CEO of Sherbourne Health Center, Linda Jackson, who wears many hats, one as the ED of the St. Mike's Academic Family Health Team, but also our lead for the Mid-East sub-region. And I also see Dr. Curtis Hanford here, who is the primary care lead for the Mid-East sub-region. We want to thank and honor all of our partners who are here today for their commitment and support to the work of Women's Health and Women's Hands and our clients. That being said, I would like to introduce the person who will be delivering the wonderful, wonderful news that we are all here to hear this morning. Unfortunately, Minister Hoskins is unable to join us due to illness, but we will be hearing from John Fraser, who is the MPP for Ottawa South and an extremely strong supporter of community health centers, particularly those in Ottawa. He has a specialty in terms of his focus on palliative care and end-of-life care. He's the Parliamentary Assistant to the Minister of Health and Long-Term Care, and he has served as MPP from 2013 up until the present day. I'd like to welcome John Fraser to the podium.
Thank you very much, Notisha, and thank you for hosting us here today at Women's Health in Women's Hands. It's great to be here. I know what it's like to prepare when you have an event like this. So I know your staff was up early this morning, and then there'll be a lot of work. And I said earlier the workday would be compressed. It'll be actually extended, but then compressed in the middle. So it is really appreciated that you took the time to host us here today. And more importantly, I want to thank you for the health center that you've built. You've built a welcoming community for women of all backgrounds, women too often face the barriers to receiving the kind of care that they need. And I am a supporter of community health centers. I've got a great community health center in my riding, Southeast Ottawa. I've been working with them before I became a member when I was working in a constituency office, and the care that they deliver in our community is critical to the health of our community. I live in an exceptionally diverse community, 125 families from 125 countries speaking 90 languages. And they do a great job in making sure that people get access to the health care that they need. And it's just appropriate for me to give them a shout out today, even though they're not here. Hopefully you'll get back to them. All politics is local. And it's nursing week, I have to mention that. So nursing week, it's a great week. Unfortunately, my favorite nurse is not in the room today. That's my mom. So I grew up with mom. My mom was an RN, worked on the floor at NDMC. So I know firsthand the kind of hard work that nurses do, all healthcare professionals do, but since it's Nursing Week, a shout out to nurses. So today's announcements, which we'll get to soon, more women, children, and men across Ontario will have access to the kind of specialized care that you see in these community health centers. I also want to recognize Adriana Tetley from the Association of Ontario Health Centres, as well as Kavita Mehta and Marg Aliferi, from the Association of Family Health Teams of Ontario, and Teresa Agnew, who's here today, from the Nurse Practitioners of Ontario. I want to thank you for joining us here today. These three associations have members that lead team-based models of primary care, relying on a fantastic group of interprofessional healthcare providers to deliver the best possible care for Ontario patients. I'm pleased to be here today to make this announcement on the day of an Ontario Primary Care Council meeting and to have representatives from both the OPCC and many other healthcare provider associations attending this announcement today. This includes representatives from the Registered Nurses Association of Ontario, and I just saw Doris, the Ontario Association of Social Workers, the Respiratory Therapy Society of Ontario, Dietitians of Canada, the Pharmacists Association, and the Ontario Psychological Association. I would also like to acknowledge the individuals from the other interprofessional teams in Ontario who are attending today. We appreciate your advocacy and support for primary care in Ontario. And I'm so humbled that we have such a wide representation to support this exciting announcement today. It's important because primary care is the foundation of our healthcare system. It is the entry point to the healthcare system for most Ontarians. And we know that we have strong partners in primary care who are committed to helping us put patients first. I want to particularly acknowledge the work of the Ontario College of Family Physicians, who may be with us here today, as they have been a strong advocate for interprofessional care through the patient medical home. And that's just one example of how dedicated primary care providers are making a difference. I want to thank all of our primary care providers for their ongoing advocacy for a high-functioning primary care system in Ontario. Our government is committed to that vision. Today, I'm here to reinforce this commitment by announcing our government's plans to make significant investments that will increase access to patient-centered care. It gives me great pleasure to announce that our government will be investing $102 million over the next 3 years to support the creation and expansion of interprofessional primary care teams across the province. So I know this is a really good thing, and I know that Minister Hoskins, Eric, really wanted to be here today to make this announcement because he is so committed to the expansion of this model of interprofessional care and for all the work that you do. So we're going to establish new primary care teams which will consist of nurse practitioners, nurses, social workers, dietitians, and other providers who will work with doctors to deliver high quality and highly integrated primary care services. We're making this investment today so that everyone across the province can have access to high quality and comprehensive primary care close to home. Funding of these teams will be allocated based on local population health needs, and we'll be working with our stakeholders to get this to the areas where it is needed most. We will ensure that every region in all of our local health integration networks has at least one interprofessional team. This means that more nurse practitioners, nurses, social workers, and dietitians and other providers will be coming to communities across this province. And it means that no matter where you live in Ontario, whether your care is anchored by your family doctor or a nurse practitioner, you would be able to get mental health supports from a psychologist or healthy eating advice from a dietitian, or get home visits from a registered nurse. We know that access to a full team is what people want in their communities. It's what keeps people healthy. We also want to recognize the important work being done by primary care providers across the province. That is why our government will be expanding on the 2016 budget commitment to improve recruitment and retention in the sector through an increase of $85 million over 3 years. On top of that down payment, we'll be investing an additional $145 million over the next 3 years. And that's really great news, and I hope it gets back home because of all the community health centers and the nurse practitioners, and I see everybody here. But back home, I hope they get the news because they've been like a dog with a bone on this. And you know what? They're right. They're right, and it's really great news that we're doing this. And it's critical to make sure that we can continue to recruit and retain people to ensure that people get access to primary care. So this funding is a recognition of the incredible value of the care provided by our primary care providers and other healthcare professionals day in and day out across the province. And those everyday victories stacked one upon the other are important to our healthcare system. Atul Gawande, and I'm sure many of you have read several of his books, but he wrote an article just recently in the New Yorker entitled The Heroism of Incremental Care, which I had the opportunity to read. And he made a really good point. And I hope if you haven't read it that you go and read it. It's a great article. He said, "Success, therefore, is not about the episodic, momentary victories, though they do play a role. It is about the longer view of incremental steps that produce sustained progress. That, such clinicians argue, is what making a difference really looks like. In fact, it is what making a difference looks like in a range of endeavors." So that's what we're talking about here today. We're talking about those individual steps, those things that relate directly to people, those small things that add up to improve people's lives. We want to continue to work with the entire primary care community to deliver comprehensive, team-based, high-quality, equitable care across the province. And we are confident that these investments will get us closer to our collective vision for primary care here in Ontario. I want to thank you very much for your time. Merci.
Thank you so much. I would like to now invite Adriana Tetley, the Chief Executive Officer of the Association of Ontario Health Centres, to the stage. She's held this position since 2004. Adriana has been tireless in her advocacy to ensure that we see these type of changes and improvements in the healthcare system. The AOHC is a provincial association of community-governed primary healthcare organizations. The AOHC centers work as interprofessional teams offering not only medical services, but also addressing the determinants of health. They serve those with complex health, social, and economic needs in rural and northern Ontario, in dense urban centers, among immigrants, refugees, and the uninsured, First Nations and other Aboriginal peoples, Francophones, and the LGBTQ community. And I'd also like to acknowledge that our board chair, Sarah Hobbs-Blythe, is with us today. Adriana has over 35 years' experience in advocacy, public administration, community development, financial and staff management, policy and board development. Her work in government, the labor movement, and several community-based associations has focused on issues related to healthcare and the determinants of health, and we're very privileged and honored to be led by Adriana Tetley. Thank you.
Thank you, and it's such a pleasure to be here. And I have to do a shout out to Teresa and Kavita. Put your hands up. I wouldn't be here, and this announcement wouldn't be here if we hadn't worked together in very strong collaboration and cooperation. And as we talk a little bit more in remarks, it really was the three of us working strongly together to bring us this announcement. I know that PA Fraser referenced it. I know that the campaigns working and talking to MPPs to talk about this came about through our collaborative efforts. So I do want to do a shout out for that and thank for the opportunity for me to be able to be here to speak. I do want to first start by thanking Natisha for hosting today. And so we're really, really pleased to be here because it's such a gem in the healthcare system. And it's such a example of what we need to all achieve in a comprehensive primary healthcare system of the future. This is where we need to go, and we have a long journey to go. The investments today are certainly that first step. As Natisha said, they not only have a strong focus on women's health, but they're leaders committed to confronting racism and oppression in all its forms, and I think that's really fundamentally. It has a vibrant program, as you've been hearing, who serves racialized women, new immigrants, and refugees, and also the LGBT community, but it provides already what we want to see. It provides seamless and coordinated care and system navigation to matter, to ensure that the people who need services get the services they need, and they do it not just through interprofessional teams, but through partnerships. And also, if you've ever had a tour here or talked to any of the clients here, you'll know that it's not just about the care they provide, but they build a place where there's a sense of belonging and inclusion. And we know as research is coming along that that is such an important part in the journey of people's health, is that they have a place where they feel like they belong, especially in a society where oftentimes there's places they don't. So that's an added value. As Natisha said, this center is one of 73 community health centers across the province whose interprofessional teams provide comprehensive primary health care. And you're going to see us push that word comprehensive because people throw it around. And we know that comprehensive is about interprofessional teams, but it's actually more than that. It is about, and we believe that comprehensive primary health care is what's going to make a resilient and strong healthcare system. But it's not only treating people when they're sick in terms of episodic, it's about looking at the root causes and figuring out how do we keep them well in the first place, but also the communities in which they live. It means about putting people first and taking into consideration all the things that are going on in their lives that are going to help create a new place. So I'm particularly pleased for MP Fraser to bring our greetings back. I'll be thanking the minister on a number of occasions, and hopefully you'll take these back to him today, because we really want to thank you on behalf of all of us in this room that you're starting to talk about primary health care as the foundation of the system. And I think that's really important as we're going through these shifts and changes. And just that statement means we need to change. And I think that's really important. And not only as you're talking it, it's starting to walk the talk. And both the combination of investing in interprofessional primary care teams and the expansion are both together laying the foundation that will allow us to work with you to transform the primary care system. So I really do want to thank you for that. A year ago, I was actually in this same room, and we stood up and we thanked the minister for the first down payment, the $85 million. And today, we're really, really pleased on behalf of 7,000 interprofessional primary care team members in over 400 organizations in this province to thank you for the ongoing investment in interprofessional primary care to the tune of $145 million. This means that our centers, our clinics, our teams can actually recruit and retain these highly skilled, caring, and committed healthcare providers that people and their communities need. So we're very, very grateful for that. But we're also very, very thankful about the investment and expansion of $102 million over the next 3 years so that more people have access to primary health care. It's going to be really important, as you say, that what determines where the investment goes is equity-informed and population-based. We need to make sure that because 100 million, while it's absolutely great, we're really excited, it's going to take us only part of the journey. So we really do need to start with the people who need it most. And so we need to take an equity-informed approach. And the discussion shouldn't be, Teresa and Kavita and I have had this conversation about more CHCs, more AHACs, more FITs, more NPLCs. It's about what are the models that are needed to meet the needs of the people most in need. And not only that, I was just waiting and talked to the partner from Women's who's doing the HIV, where are you? Can you shout out? We were just talking in the hall while we're waiting. And the partnerships that are being done with specialists on HIV, AIDS, or other kind of partnerships, we need to think about how do we expand those teams in different ways, right? And so we have another really interesting program called Team Care. And it's a program where we have physicians who have very complex people who don't have access to teams. How can we help them who have complex people connect to our FITs, to our nurse practitioner clinics, to our community health centers through a shared care collaborative program? And that's the kind of innovation that we can bring to this discussion. We also have our leaders in our communities who are ready to go. Our experience has shown that no matter what part of Ontario you're from, whether it's rural, urban, or suburban, north or south, it is the local people who know what their communities need and how to meet these needs. Franco-Ontarians, racialized LGBT, and people from across the life course, from children to seniors, palliative, they often require a uniquely tailored approach to address their needs and the causes of their health and illness, especially in a system that's often stacked against them. Right? And so that's really where we need to go. So research shows that about 1 in 5 Ontarians don't have access to or face significant barriers to health. And we believe that those groups of people actually will benefit from interprofessional primary care to break their barriers down. Right? So the government's announcement to ensure 1 interprofessional primary health care team in every sub-region is a very good start to removing those barriers. So we, collectively in this room, all of them, I am sure, all the different associations here in this room are really looking forward to working with you on this expansion plan. As teams of, and I'm sure I'm going to miss somebody, but I do want to say healthcare providers, including physicians, nurse practitioners, registered dietitians, physician assistants, dietitians, pharmacists, mental health workers, health promoters, community workers, social workers, physiotherapists, chiropodists, I'm sure I missed some, we're ready to step up to work with you. We have communities who are ready to work with you. We have centers and teams who are ready to open up new satellites in communities where it's needed. And we're ready to partner with community support specialists, mental health agencies to figure out how do we expand their services and make sure that we meet these needs. And finally, the minister was there last week, so I thought I'd do a shout out because it's one of the ones in your riding as well. In Carlington, very interested in looking at how we can use community hubs, where we have seniors housing, assisted living, and other kind of programs co-located with teams to make sure we provide integrated services. And you have a great example happening close to you in your riding. So thank you. Thank you on behalf of all of the interprofessional teams. Thank you for the leaders in our sector in believing in us and having the confidence that we can work with you to make a difference. Thank you for your commitment to comprehensive primary health care and team-based care, and thank you for your commitment to health equity. In closing, I want to say, and you can deliver this message to the minister in his, as he's getting better, that this was planned before we knew this event was going to happen. But today and in the next couple of days, we are launching a thank you social media campaign to the minister and the premier for these announcements. This was already planned before today. It's great that it fell onto today. So hopefully we'll get some media chatter out there so we can thank people for making this investment in us. So thank you very much.
Thank you, Adriana. I would now like to welcome Doris Grillspun for some remarks from the RNAO.
Well, first of all, on behalf of all the nurses in this province, thank you, but congratulations to nurses for the amazing work during Nursing Week. And that goes for RNs, RPNs, MPs, and every single person that helps nurses. And with that, let me give a shout out to the Ontario Primary Care Council, which I had the privilege to launch with the Ontario Medical Association several years ago, and to all the members of the council, Ontario College of Family Physicians, at the time the colleague was there, the nurse practitioners, the pharmacists, the OACC, the Ontario Community Health Centers, RNO, of course, which was a leading organization with OMA. This is an issue that we at the Council spoke significantly and for several years, sending letters to the minister, sending letters to the premier saying interprofessional care is the way to go. And I want to thank the Association of Community Health Centers for the amazing role you do with not only vulnerable populations, but you should do with all populations. Side by side, though, I also want to thank the nurse practitioner-led clinics, which also do amazing work with interprofessional teams led by nurse practitioners, the family health teams led by physicians, but in interprofessional teams, and the AIACs for indigenous people. Interprofessional teams, in the view of RNO, ought not to deliver care only to vulnerable populations. Every single Ontarian can benefit for interprofessional care. So as for RNO, we are continuing to push forward, and the fact that the government is putting funding for interprofessional teams in every single community is an indication that hopefully down the road, every single Ontarian will have access to interprofessional teams because they all can benefit. Otherwise, we are looking downstream, not upstream, to prevent that people actually become ill in the first place. Thank you to absolutely everybody, nurses and non-nurses. We all work together. And also thank you for the media for being here and giving legs to something that Ontarians will benefit down the road significantly. John, thanks for your assistance in stepping in for the Premier, and to the Premier, wish him well. If he needs a nurse, an RN, a nurse practitioner, we will be there. We will help, absolutely.
I think he's his own primary health care lead.
Oh, well, I don't know about that. In any case, thank you to everybody, and happy Nursing Week to everybody. Thank you.
Thank you very much. With today's announcement, one of the things that we're very excited to be able to think about is the retention of highly skilled, highly qualified healthcare professionals within the province, but also within community healthcare settings. And I would like to invite Renee Bradley, who is one of Women's Health and Women's Hands nurse practitioners, to the podium. We're very proud to have her with our team. And I can't say enough about the staff of Women's Health and Women's Hands as they stand here for long hours. But it shows their dedication to the work that we do. Renee has completed her Master's of Nursing and her nurse practitioner degree from the University of Toronto in 2016, so she's a very new graduate. And she's recently come to Women's Health and Women's Hands with extensive nursing experience, working in medical, surgical, orthopedic, and surgical intensive care units. She also has a passion for chronic disease management and women's health. And these are the type of professionals that we hope this announcement will enable us to recruit and retain within the community healthcare setting. So Renee.
Thank you, Notisha, and good morning, everyone, and happy Nursing Week to all the nurses in the room. My name is Renee Bradley, and I'm a new graduate nurse practitioner here at Women's Health and Women's Hands. And as a new graduate at a community health center, it has been an incredible experience to work with such a strong interprofessional team of physicians, nurse practitioners, registered nurses, registered dietitians, mental health therapists, social workers, and chiropodists. Together, we are able to provide holistic and client-centered care to underserviced populations. Community health centers across the province are dedicated to disease prevention and health promotion to help their clients reach optimal health. The investment in recruitment and retention for interprofessional primary health care teams will improve continuity of care, which is so important to those with complex health conditions. The expansion of interprofessional primary care teams will also create more jobs for nurse practitioners and for new graduates like myself throughout the province. This will provide more Ontarians with access to high-quality primary health care services in their communities and keep nurse practitioners in primary health care settings. Thank you to John Fraser and the Minister of Health, Dr. Eric Hoskins, for this announcement today and the investment in primary healthcare teams. It is truly an exciting time to be a nurse practitioner in Ontario. Thank you.
Thank you so much, Renee. And once again, thank you, MPP John Fraser, for filling in last minute with this extremely, extremely important announcement. And we hope that you take our remarks back to the minister in terms of our gratitude. And we'd like to thank the ministry for their commitment to interprofessional care and making it a collective strategic priority. The inclusion of diverse healthcare voices in collaborative decision-making, it shows a commitment to all Ontarians, particularly the most marginalized that we serve. Now for the work. We've gotten the announcement. Now we have to do the work. So we have to look at particularly the associations that are present in the room. I'm really going to challenge you to help us develop competencies and standards for interprofessional care. And we also are looking towards the continued support of our government to not only support a culture required for interprofessional care within our healthcare settings, but also the necessary fiscal resources that will help us develop and implement strong teams, but also help us to evaluate and develop best models of practice. And I have to put a plug as a feminist organization that women-dominated professions need to be treated equitably and resourced equitably. So once again, I'd like to thank you, MPP Fraser, and also your commitment to the CHCs in Ottawa, who we all work with closely. I want to thank everyone for their time today and your dedication to the work that we're all collectively doing. I understand that you will stay around to speak to people. Please, if anyone would like a tour of Women's Health and Women's Hands, we are one of the 73 CHCs that Adriana talked about. We think we are the best, but that's for today. I speak on behalf of all community health centers in saying that we believe that our model of care is one of the best in the province. And we would like to host you further if you'd like to see a tour or speak to the wonderful staff who can actually talk to you about the wonderful work of interprofessional teams. So thank you all.